Hi, my name is Maricela and I'm a Night Gown nursing student. I am going to be demonstrating the NG tube video insertion. This is going to be my patient. I hope that I'm at a right angle. If not, I will try to show you in the video as I'm going the proper mechanics of inserting NG tube video. So first thing I'm going to do is I'm going to check the provider's orders, make sure I'm with the right patient, make sure the right procedure and the reason for the procedure. Okay, and then I'm going to go ahead and go into the room. Knock, knock. Hello, can I come in? Hi. Hi, Mrs. Smith. How are you doing today? Good, good. My name is Maricela and I'm the nurse today. Looks like we're going to be putting an NG tube in your nose today to help get rid of some of that stomach contact that you keep vomiting and we're trying to keep down, okay? Are you okay with that? Great. Can you please verify your name and date of birth? Sure. Donna Smith, 6/21/79. Okay, great. And then Donna, do you have any allergies? No? Okay. So I'm going to go ahead and sanitize my hands before I get started with the treatment. And then Donna, we're going to go ahead and place a nasal gastric tube in your nose. I'm going to gather my supplies and then I'll go over this procedure with you, okay? So I have the 60cc syringe. I've got my pen light. I've got the basin. I've got the tape to keep it secure in place. I've got the water with the straw for the patient to drink as the tube is going down the nose. I've got the lubricating jelly here to lubricate the nasal gastric tube. I also have my pair of gloves and I have the nasal gastric tube over here and the packages in here, okay? And then I have some tissue and then I have the drape for the patient. The only thing I don't have is I don't have the pH content strips. I don't have a nasogastric suction machine, and I do not have a safety pin. But I will verbalize that as I go through and verbalize that I am using the safety pin. Okay, all right. So first thing, like I said, I'm gonna wash my hands and I'm gonna prepare the patient and let them know the procedure. Mrs. Smith, we're gonna go ahead and insert a nasal gastric tube. It's gonna go through your nostril, gonna bypass your throat and it's gonna go down into the xiphoid process, okay? You may have some discomfort, maybe not. If you do begin to get any gag reflex, don't worry. We'll go ahead and lift your head forward, put your chin down, and have you take a couple sips of water, which will help the process of the tube going down more smoothly. If at any rate you feel any discomfort or any pain at any time, just raise your hand and let me know we can stop, okay? So I'm just gonna do a quick assessment on you. We're gonna get some vitals on you, make sure you're stable. Looks like the vitals are stable. We're gonna keep a pulse ox on you to check oxygens at all levels to make sure that you don't have any occlusion or respiratory issues with this procedure. And so I'm gonna go ahead and get my gloves on, okay? And I'm going to, before prepping the patient with the tube, I'm gonna put the tube into the, some warm water in the basin to prepare the tube, okay? So I'll set the basins here, some tube basin, put it here, okay, some warm water. All right. And then I'm going to assess the patient's nostrils. I'm going to assess the patient's nostril and I'm going to be looking for any, we're going to have you hyperextend your neck, okay? And so I'm going to go ahead and put your head back a little better. There we go, hyperextend your neck. And we're going to be checking the nasal area. We're going to be looking in the nostril, check for any occlusion, any tissues, intactness, irritation, or abrasions, any possible areas that may block the tubing from going in, okay? And then we're gonna go ahead and test the airflow in your nose. So I'm gonna go ahead and put my finger on one of your nares. If you go ahead and breathe out on one side of your nose, your right side, perfect. Go ahead and breathe out of your left side, good. So it looks like the airflow is better on the left side and it's also a better option for you to be able to see me do this procedure, okay? All right, so after assessing the patient to make sure everything is clear to go to start the nasal gastric tube insertion, I am going to grab my nasal gastric tube here. Okay, it's been prepped in warm water. And I'm going to, the tip of it, and I'm going to measure from the nostril to the earlobe to the xiphoid process, okay? So that looks like it leaves you at about 55, okay? And then I'm gonna put a tape on here. Just gonna mark the 55, okay? All right, so that's marked there, okay? All right, and then I'm gonna call for x-ray so that once I get the nasogastric tube in, they can come and check replacement. All right, So then I'm gonna go ahead and Mrs. Smith, I'm gonna go and start the process. If you're okay with that? Okay? All right, perfect. I'm gonna go ahead and lube the tip of the catheter here with some lube to make it go down smoother. This is just a little lube that's gonna help things go down a little smoother, okay? Please keep your head hyperflexed, extended, and let me know if you have any discomfort, okay? So we're gonna go ahead and take the nasal tube here, and we're gonna go ahead and insert it in the left nostril. We're gonna push it down about until we get a gag reflex in the oral pharynx, okay? So about halfway in, okay? So the patient starts to have gag reflex. Okay, go ahead and tilt your chin down. We're gonna take a drink of water. Just take a couple sips of water there. Good. All right. We're gonna keep on going about 2 inches every time. Please let me know if you have any discomfort. Okay, we're gonna keep going. Patient's tolerating the procedure well. Keep going a little while, a little bit more, maybe a little drink of water. We're almost there. You're doing good. Okay, so we have reached the point of insertion at 55. Okay, once that is stable, I'll make sure Akershaw is on the way to come and check for placement content. I'm going to secure the tubing here with a piece of tape to make sure that the tubing does not go anywhere or get dislodged from the nasal area. Okay. Okay, I'm gonna tape down the nose here. The tape isn't very good here. Oh my goodness. Okay. Ooh, fuzz. Okay. Alright, so it's and get another tape really quickly here. Not working very well there. Okay. Alright, I'm gonna go ahead and tape this down here to secure the nasal thing, nasogastric tube on the nose there, okay? My goodness. Okay, we're just gonna say that it's secure here, okay? All right, and then while that's being secured there and the x-rays being done, I'm gonna go ahead and check for gastric contact. So I'm gonna remove the cap here and I'm going to use the 60cc syringe. I'm gonna pull back just about 10 cc's of the gastric content. Okay, and get the gastric content and I'm going to put it in the basin. Okay, and then I'm going to clamp this back on here. We're going to get the pH test strips and we're going to compare it to the pH test strip container. I'm going to test the gastric content. Okay, and it looks like it measures about 3.5 to 5.5, which is within normal range for gastric content. Okay, and then how you doing there, Ms. Smith? Okay, good. Once we verify that the tube is in place in the proper area and the Zymphoi process and able to be seen and working properly, we're going to go ahead and connect this to the suction canister, which I do not have here, but we will have connected to the suction canister. And then I'm going to pin, I don't have a pin on me, I'm going to pin this to the patient's gown to keep more stability on the nasogastric tube, okay? And while that's suctioning, we're going to check for the drainage, the patency, the amount of drainage, the color of drainage, and we monitor that probably every 2 hours to make sure that everything is coming out as it should be, and there are no complications, okay? And then we are going to document our findings, and we'll make sure that everything is in place here. The patient's comfortable and in safe position. We're going to go ahead and put your bed down to lowest position, Mrs. Smith, and if you could please stay in that 45-degree angle, it will prevent from you choking and having any aspirations, okay? I'm going to go ahead and document what the findings, procedure, how the procedure went, how the patient tolerated the procedure, if there was any complications during the procedure, and then we'll continue to monitor the patient while they are receiving the nasogastric tube suction for the excessive vomiting that the patient was having. Okay, and then I'm going to gather my supplies and then take my gloves off, perform hand hygiene, document, and then leave the room, take my supplies and remove them.